Hello everyone, I am thrilled to share my very first video on community medicine with you all. Today I will be talking about concept of prevention and concept of disability. These concepts are at heart of how we prevent diseases and protect health of our communities. This is a very high topic for MBBS theory examination, Viva Voce, and various MCQ examinations like NEET PG, FMGE, and INI-CET. In the last of this topic, I will be discussing various MCQs with explanation as well. Firstly, I will be talking about concept of prevention. Various levels of preventions are primordial, primary, secondary, tertiary, and a newer one that is quaternary level of prevention. We will discuss each level of prevention by including its definition, aim, and modes of intervention. You should know primordial and primary level of prevention. These focus on healthy persons or total population. So these focus on healthy persons or total population. And secondary and tertiary level of prevention, these two focus on those who already develop a disease, who already develop a disease. Let's walk through each level of prevention one by one. So first is primordial prevention. It is prevention of emergence of risk factors. So we are doing primordial prevention when there is no risk factor. So we are doing it when there is no risk factors present. So we can define it as prevention of emergence of risk factors. Prevention of emergence of risk factors in a population in which they have not appeared yet. So it is the prevention of emergence of risk factors in a population in which they have not appeared yet. What are the modes of intervention in this level of prevention? So modes of intervention are individual education and mass education. Individual education and mass education are the modes of intervention. Then primordial prevention is best level of prevention. It is best level of prevention. Measures begin during childhood, continued during adolescence, and maintained during youth, adulthood, and old age. What are the examples of primordial level of prevention? First is educating school going children. Educating school going children about harmful effects of alcohol consumption and smoking. This would deter them from developing these habits during adulthood. Another example is teaching yoga and meditation. Teaching yoga and meditation to young children. So this is all about primordial prevention. Now we talk about primary prevention. Here the risk factors have emerged, but disease has not been developed yet. So risk factors are present, but disease is not developed yet. So we can define primary prevention as action taken before the onset of disease. Action taken before the onset of disease, which removes the possibility of disease in future. So primary prevention is defined as action taken before the onset of disease which removes the possibility of disease in future. So a stage of disease in which we are doing primary prevention is pre-pathogenesis phase. Stage is pre-pathogenesis phase. Aim of primary prevention is to reduce the incidence of disease by modification of risk factor. So aim of primary prevention is to reduce the incidence of disease. Modes of intervention here are health promotion and specific protection. So modes of intervention in primary prevention are health promotion and specific protection. Now we will talk about health promotion. Health promotion is achieved through health education, environmental modification, nutritional intervention, and lifestyle and behavioral changes. Health education can be formal or non-formal. Examples of environmental modification are provision of safe water, installation of sanitary latrines, ensuring proper roads, with adequate transport facilities, this will decrease RTA, road traffic accidents. Then adequate ventilation in a house, that decreases chances of respiratory diseases. Then examples of nutritional intervention are nutrition improvement in vulnerable groups, child feeding programs, and food fortification. Lifestyle and behavioral changes are adequate physical activity, adequate sleep, and healthy diet. So health promotion can be achieved through health education, environmental modification, nutritional intervention, and lifestyle and behavioral changes. Then we will talk about specific protection. Examples of specific protection are use of contraception, immunization against vaccine preventable diseases, chemoprophylaxis, it means providing medicines like antimicrobials, for disease prevention or infection prevention. For example, we give erythromycin to contacts for diphtheria prevention. We give isoniazid and rifampicin for tuberculosis preventive therapy. Another example of specific protection is accident prevention by use of seat belts. Then use of specific nutrients. For example, we give mega doses of vitamin A to children to prevent blindness. We give iron and folic acid tablets to pregnant and lactating women, to children and adolescent girls to prevent anemia. Then another example of specific protection is protection from occupational hazards and carcinogens. So this is all about primary prevention. Next level of prevention which we are going to discuss is secondary prevention. We can define secondary prevention as actions taken actions taken to prevent the disease progress at its early stage and thus preventing complications related to disease. So, this is defined as actions taken to prevent disease progress at its early stage and thus preventing complication. So, here the disease is at its early stage. And we are preventing complications by doing secondary prevention. A stage of disease in which we are doing secondary prevention is early pathogenesis phase, aim of secondary prevention is to reduce the prevalence of disease. In primary prevention, the aim was to reduce the incidence of disease. Here, the aim of secondary prevention is to reduce the prevalence of disease. Modes of intervention are early diagnosis and treatment, modes of intervention in secondary prevention are early diagnosis and treatment. We can make early diagnosis, for example, for tuberculosis by sputum smear examination. For acid fast bacilli, or we can make early diagnosis of malaria by peripheral smear examination. for malarial parasites, or we can also do screening for hypertension by measuring blood pressure, or we can screen cervical cancer by pap smear. Then we can provide treatment, for example, providing DOTS therapy for tuberculosis or giving multi-drug therapy for leprosy. Thus, we can say secondary prevention is largely a domain of clinical medicine. It is largely a domain of clinical medicine. Screening and surveillance are the important tools for secondary prevention, and government health programs. Government health programs usually run at this level. This is about secondary prevention. So, next is tertiary prevention. Now, disease has already progressed to advanced stage. So, in tertiary prevention, we are trying to limit impairments and disabilities. Here, disease is already in advanced stage. We are trying to limit impairment and disabilities. We can define tertiary prevention as measures available measures available to reduce or limit impairment and disabilities and to promote patients' adjustment to irremediable or incurable conditions. So we can define tertiary prevention as measures available to reduce or limit impairment and disabilities and to promote patients' adjustment to irremediable or incurable conditions. Stage of disease in which we are doing tertiary prevention is late pathogenesis phase, and aim of tertiary prevention is to reduce number and impact of complications. Modes of intervention are disability limitation, and rehabilitation. Example of disability limitation is providing physiotherapy to poliomyelitis cases. If disability has occurred, then we can do rehabilitation. So how can we rehabilitate patients? We can uh, open or establish schools for blind children. Can establish schools for blind children. Can provide aids for crippled persons. Leprosy patients can undergo reconstructive surgery. Or we can facilitate change of profession to more suitable one. These are the various examples of rehabilitation. Now we will discuss a newer term, quaternary prevention. This can be the potential MCQ in upcoming exam. We can define quaternary prevention as actions taken to protect individuals from medical interventions that are likely to cause more harm than good. Examples of quaternary prevention are discouraging overuse of antibiotics, discouraging overuse of antibiotics, preventing polypharmacy, that is multiple medications in elderly, and avoiding unnecessary diagnostic tests. Avoiding unnecessary diagnostic tests. So quaternary prevention is to protect individuals from medical interventions that are likely to cause more harm than good to the person. Examples are discouraging overuse of antibiotics, preventing polypharmacy, that means multiple medications in elderly, and avoiding unnecessary diagnostic tests. So these are the important concepts and examples in the topic levels of prevention. In next video, I will discuss various MCQs related to this topic which are asked in your FMG, NEET PG and INI CT exams. Thank you for the patient listening.